Today I'm here to talk about the President's Task Force on Environmental Health Risks and Safety Risks to Children. And I'm curious how many of you in the audience have heard of this task force before this title right here? Okay, I see some people that are part of it too, so it's great to see you. But I'm excited to share more with you all that aren't familiar with the task force today, because we thought that would be of interest. So when Kim and I learned about this symposium, we were excited to see the inclusion of children's health as a focus, and we thought you all might want to hear more about the task force and also the subcommittee that Kim and I co-chair on chemical exposures. And then we decided to charge ourselves with presenting a large list of all the federal tools and resources and activities that relate to children's health in the Exposome. So obviously this was a huge task, and we're very grateful to all the members of the subcommittee for helping us put this list together. So the President's Task Force, or the PTF as we call it, was established by Executive Order 13045 in 1997. And it has addressed issues in children's health ranging from childhood asthma to unintentional injuries, lead poisoning, healthy learning environments, climate change, etc. It is co-chaired, the steering committee is co-chaired by EPA and HHS, and it serves as a forum for government and non-government officials to interact on children's environmental health issues and safety issues. It's the focal point for coordinating federal government efforts to explore, understand, and act to improve children's environmental health. And the task force also works to increase awareness about children's health issues, including emerging risks such as climate change. Here's a list of all the different agencies that are members of the task force. You can see this list includes some of the traditional public health agencies and beyond as well. The current subcommittees on the task force are asthma disparities, climate emergencies and disasters, which we call SCED, lead exposures, and chemical exposures, which we've nicknamed checks to kind of give you that call back to your childhood. And I personally always find it helpful. There's a lot of interagency work groups and task force and committees. I find it helpful to hear about some of the key accomplishments that work group has had in order to better understand its role and its purpose. And so here are some of the key accomplishments of the task force. First, the National Children's Study. The task force recommended the initiation of a prospective cohort study at the national level from birth to adulthood to evaluate the effects of environmental exposures on child health and human development, and that became the National Children's Study, which we'll talk more about lately, has become the ECHO study. There are also a couple of action plans that the task force has put out over the years, and these continue to guide federal activities in these areas, and those are the Action Plan to Reduce Asthma Disparities and the Federal Lead Action Plan. And here's a link to our website, but I also have a QR code later, so don't feel like you have to write that down. We are currently working to update the work plan of the task force. It was last updated in 2016, and the new version should be coming out like any day in the next few weeks. It will be a 5-year outlook with both short-term and long-term actions in these 4 categories, all of which touch on the different topics that we've talked about here over the past couple days: identifying and addressing data gaps, regulations and policy, communication and engagement, and interagency coordination. So now moving to the subcommittee on chemical exposures that I'm lucky to co-chair with Kim. The goals of checks are to enhance coordination of federal research planning and application, to lead federal discussions on critical topics around children's exposure to chemicals, and to leverage the expertise of the task force to solve problems. Our subcommittee has a broad focus on children's exposures rather than focusing on a specific chemical or class or exposure route, so we feel like that is aligned with the concept of the Exposome. And we're looking for solutions that can be applied across chemicals and across agencies, and focused on sharing information to lead to coordinated efforts across agencies as well. So in October of 2022, we had our kickoff meeting, so we're still in our toddler phase as a subcommittee. Last year in 2023, we held subcommittee meetings each month where we captured and discussed tools, resources, and ongoing efforts in the federal government in children's exposure to chemicals. And we focused on coordination and setting that baseline, getting everyone on the subcommittee on the same page about what was already happening so we could think about where we could better collaborate and fill some of the gaps. This year in 2024, we are going to be sharing those tools, resources, and ongoing federal efforts, including right here today. We'll publish that work plan that I mentioned, and our focus will be on action, those actions that will be captured in the work plan, and communication about these tools and resources and efforts. Okay, here's the QR code I promised. Hopefully the boomers in the audience know how to use these. You just point your camera on your phone at the QR code and it will come up with a little link. So we updated our webpage for checks to include links to everything that I'm going to be talking about today so that you don't have to scramble to write everything down. You can just go to one place and look for all these resources and tools, and we'll be continuing to keep this up to date over the years so that you can always come back here if you're looking for information about children's exposure to chemicals and what's happening in the federal government. Okay, so it'll come up again later if you didn't catch it that time. So next I'm going to talk about some of those tools and resources that relate to the exposome and children's health. As we've been hearing throughout this meeting, the exposome is very complex and many tools can help to advance the field and answer questions of the exposome. We need tools that characterize sources and pathways and receptors and health outcomes in all population groups. And we also need tools and strategies to combine outputs from these multiple tools. So I'm going to walk through several tools and resources relevant to the exposome and children's health. And as I go through these, I challenge you all to think about how they might be able to be combined, because that's some of what we're thinking about within our subcommittee. How they might inform something like the human exposome map that Dr. Wright described earlier today. And also how you can use them in your own work to answer some of your research questions. Okay, so first up is EPA's Expo Kids. This is a tool that helps scientists and researchers explore questions in children's health risk assessment and management by visually depicting the impact of aggregate exposure to contaminants via specifically the oral route to children throughout their lives. And it's online, it's in R Shiny, which sounds really fancy, but I think it just means that you don't have to download it and use your own version of R. It's just through the web. Someone who knows more about R maybe can correct me if I'm wrong. But here on the screen is an example of an output from this tool. I know it's really tiny text and it's hard to read, so I'll walk you through it. This shows the average daily dose for one of the phthalates, DHP, by life stage. So starting on the left side is young infant through adult. And each of the colors represents media, a source of the exposure. So the dark purple that's really prominent in the infant stage is breast milk. It also captures dietary exposures, exposures to soil and water. And you can see this really highlights how exposures to one chemical can vary in terms of the source across the life stage. So this can be useful as a tool in risk assessment and managing those risks. Next is EPA's America's Children and the Environment. This is an indicators report that EPA has put out since 2000. It used to be a paper report, now it's an online tool. And in this report, we are tracking the children's environmental health indicator data throughout the government and using this to educate the public and policymakers on trends in children's health. So our last update was in October of 2023, And at that time, we had a lot of health disparity data, so the indicators stratified by race and ethnicity and income. We had a lot of that data in ACE in the tool, but it was buried in these tables. And so with that update in October, we've brought it into the graphs, which is really exciting to see. And we're also working on expanding the indicators to have more indicators that focus on EJ. The last time we added indicators to this report was more than 10 years ago, so we're excited to have the opportunity to revisit this and think about what is new in children's environmental health that maybe wasn't captured 10 years ago. And we had a workshop last week on that, which I see some people here that were at that workshop. Some of the data for the ACE report come from CDC's NHANES. I'm sure a lot of you are familiar with the NHANES, the National Health and Nutrition Examination Survey from CDC, but I wanted to highlight a few points on this. One is that this survey is really unique in that it combines interviews and physical examinations, so I think it can help to answer some of these questions that we've been talking about regarding life experiences and how those might relate to some of the biomarkers or exposures. Those are the types of questions that can be investigated using NHANES data. I also wanted to make sure that people know that NHANES CDC has been storing biospecimens from this survey over the years, and those are also available to researchers because they wanted to preserve that rich data set so that people can ask new questions as things come up in the future. So there is a stored biospecimen program that the CDC has for those samples. And similarly, NICHD's DASH, or Data and Specimen Hub, also has an opportunity to request biospecimens from selected studies conducted by NICHD. There are 225 studies archived here, including ECHO cohort, for which, hot off the press, there was just a second data release from the ECHO cohort last week. And this new release includes bioassays of chemical exposure, including flame retardants and metals. And if you want to learn more about that, we have Susan here who can help you get access to that information. Next, CPSC, the Consumer Product Safety Commission, has a system called the National Electronic Injury Surveillance System, which tracks consumer product-related injuries across the United States. So now we're getting into the safety side of the task force. And they use these data to produce nationwide estimates of product-related injuries. And one of the opportunities that we've been talking about within checks is that this data system includes product category information, but we don't necessarily know which chemicals are in those products from the data that are reported in this system. So that could be an opportunity to combine some data systems to get that chemical specific information. Okay, here's where I was going to take a detour into the EJ world from the children's health world, but I feel like we've really talked extensively about a lot of these tools. So the one thing I want to highlight here is that EPA's Environmental and Climate Justice Community Change Grants Program is open now. And that program will be awarding $2 billion of grants to communities to work on environment and climate justice. And the EPA has also funded, Dr. Bullard mentioned, the TICTACs, the Thriving Communities Technical Assistance Centers, and those are set up to help community organizations apply for these grants and be successful in getting those awards and implementing the grants as well. We talked about, I believe, all of these mapping tools. We also talked about all of these indices, so we'll just breeze through those. I also wanted to share some recent publications from our federal colleagues, and these go into more detail about how people are thinking about the exposome and exposure science and cumulative impacts and environmental justice within the government and how to apply those. And again, these links will also be on the CHECS website. Okay, last section. Moving into the ongoing federal efforts on children's health and the Exposome. So this is a list of the NIEHS and NIH Children's Environmental Health Research and Training activities. Kim probably had some brilliant things to say about this slide, but I'm not as intimately familiar with all these programs, so I'm going to talk about a couple of them in the next few slides. One of the key programs that EPA helps to fund in the area of pediatric environmental health is the PACEUs. I know we have some PACEU doctors in our midst. The PACEUs were created to address gaps in the field for medical practitioners. It's a program that's co-funded by ATSDR and EPA. It started in 1999, and it's a national network of clinical and public health experts in environmental health for children. And if you go somewhere like the APHA meeting, you'll hear people talk about the PACEUs like constantly. It's just like heartwarming to hear all the stories that people have related to the PACEUs. They provide medical advice on exposure to environmental hazards, with a focus on the exposures that impact early life stages and reproductive outcomes. And they're also focused on community outreach, consultation and referral, and training of health professionals. And a related program that NIEHS started just a couple years ago is the Pediatric and Reproductive Environmental Health Scholars. This is a training program for pediatric health providers and OBGYNs and other healthcare professionals to address environmental health issues. Okay, sorry, this text is a little small because there are so many current children's centers. From 1998 to 2019, EPA and NIEHS jointly funded children's centers, and now each agency funds its own, with NIEHS focused on research translation and EPA focused on research and cumulative impacts. So you can see here some of the children's centers that are currently funded. The NIEHS Research Translation Centers are also, they have a coordinating center at the Children's Environmental Health Network run by NSA. And there are several EPA grants that focus on children's health as well, including through some of the more early life stage focused requests or opportunities, and then there are also cumulative health impact grant awards that have included some centers focused on early life stages. So among the richest sources of data are prospective cohort studies. These are also the most expensive to run, of course. I mentioned earlier the National Children's Study. This was authorized by the Children's Health Act in 2000, and it was planned to be a large-scale, long-term study of U.S. children and their parents on environmental influences on children's health and development. But after several years of piloting, ultimately the decision was made that as it was designed, it was not feasible. So the NIH began to consider alternative approaches, and that's when they landed on the ECHO program in 2016, which takes a combined cohort approach to more efficiently study research questions by standardizing data collection across many smaller cohorts. This helps to bring diverse participant populations together and answer questions that small studies might not be able to answer alone. And you've already heard a lot about the ECHO study earlier in this symposium as well. Some other ongoing federal efforts and things that we've been talking about within our subcommittee. We've seen a lot of efforts to integrate environmental and health measures into existing cohort studies and national surveys. You heard a little bit about this with the All of Us research program, where they're looking at environmental survey questions through that study. There's also work on exposure ontologies to make sure we're all speaking the same language when we talk about exposure science. And new technology and tools have a great role to play here, with things like non-targeted analysis to help us identify emerging contaminants. Toxicology has NAMs, exposure science can have NAMs too. One example is EPA's ExpoCast. And thinking about citizen science and wearables that can help us collect exposure data in communities and at the individual level. And there's also some source-specific work in the government with FDA's Closer to Zero initiative on heavy metals in foods, and the National Emerging Contaminants Research Initiative, which focuses on water exposures. That's the NECRI. And another hot off the press announcement is that they just released their implementation plan on Friday. So that captures the actionable objectives for addressing the strategy of the NECRI, which is run out of the Office of Science, Technology, and Policy at the White House. So again, here's the QR code if you need it, if you didn't quite get it earlier. And I want to make sure to thank all of our CHEC subcommittee members, some of which are here in the audience today, for helping us pull together all these resources and for all of your hard work. And in the next slide, I have all their names listed. I'm just making sure everyone has had a chance to get the QR code. So here are all of the members of the subcommittee and my contact information and Kim's contact information if you'd like to talk further.